An introduction to the lymphatic and immune systems. The lymphatic system is a series of vessels, ducts, and trunks that remove interstitial fluid from the tissues and return it to the blood. The lymphatic vessels are also used to transport dietary lipids and cells of the immune system. Cells of the immune system, lymphocytes, all come from the hematopoietic system of the bone marrow. Primary lymphoid organs, the bone marrow and thymus gland, are the locations where lymphocytes proliferate and mature. Secondary lymphoid organs are the site in which mature lymphocytes congregate to mount immune responses. Many immune system cells use the lymphatic and circulatory systems for transport throughout the body to search for and then protect against pathogens. This chapter begins by describing the anatomy and physiology of the lymphatic system, whose immune functions lead us into a discussion of the body's multifaceted defenses. Together make up the immune system. Since the lymphatic system shares organs with a number of other body systems, the pathology discussed near the end focuses on disorders of the immune system. So in order to explain the lymphatic system, the lymphatic vessels begin as open-ended capillaries which feed into larger and larger lymphatic vessels and eventually empty into the bloodstream. Along the way, the lymph travels through the lymph nodes, which are commonly found near the groin, armpit, chest, neck, and abdomen. Humans have about 500 to 600 lymph nodes throughout the body. Several organs and tissues that participate in immunity are also part of the lymphatic system. Lymphatic vessels and blood vessels are similar in structure and function. Lymph is not actively pumped by the heart, but is forced through the vessels by the movements of the body muscles. The lymphatic capillaries. An important function of the lymphatic system is to return the fluid, lymph, to the blood. Lymph may be thought of as recycled blood plasma. Blood pressure causes leakage of fluid from the blood capillaries, resulting in the accumulation of fluid in the interstitial space. In humans, 20 liters of plasma is released into the interstitial space of the tissues each day due to capillary leakage. The blood vessels reabsorb 17 liters of this interstitial fluid, leaving 3 liters in the tissues for the lymphatic system to transport back to the circulation. If the lymphatic system is damaged in some way, such as being blocked by cancer cells or destroyed by injury, interstitial fluid accumulates in the tissue spaces, causing a condition known as lymphedema. Lymphatic capillaries, also called the terminal lymphatics, are vessels where interstitial fluid enters the lymphatic system to become lymph. Located in almost every tissue in the body, these vessels are interlaced among the arterioles and venules of the circulatory system in the soft connective tissues of the body. There are some exceptions, which include the central nervous system, the bone marrow, bones, teeth, and the cornea of the eye, which do not contain lymph vessels. So larger lymphatic vessels, trunks, and ducts. The lymphatic capillaries empty into larger lymphatic vessels, which are similar to veins in terms of their three-tunic structure and the presence of valves. These one-way valves are located fairly close to one another, and each one causes a bulge in the lymphatic vessel, giving the vessels a beaded appearance. In general, superficial lymphatics follow the same routes as veins, whereas deep lymphatic vessels of the viscera generally follow the paths of arteries. The superficial and deep lymphatics eventually merge to form larger lymphatic structures known as lymphatic trunks. On the right side of the body, the right sides of the head, thorax, and right upper limb trunks drain lymph fluid into the right subclavian vein via the right lymphatic duct. On the left side of the body, the trunks from the remaining portions of the body drain into the larger thoracic duct, which drains into the left subclavian vein. The thoracic duct itself begins just beneath the diaphragm in the cisterna chyli. The primary lymphoid organs. The primary lymphoid organs are the bone marrow and thymus gland. The lymphoid organs are where lymphocytes mature, proliferate, and are selected, which enables them to attack pathogens without harming the cells of the body. Bone marrow. Recall that all blood cells, including lymphocytes, are formed in the red bone marrow. The B cell undergoes nearly all of its development in the red bone marrow, whereas the immature T cell, called a thymocyte, leaves the bone marrow and matures largely in the thymus gland. The thymus gland, where T cells mature, is a bilobed organ found in the space between the sternum and the aorta of the heart. Connective tissue holds the lobes closely together, but also separates them and forms a capsule. The loss of immune function with age is called immunosenescence. One of the major causes of age-related immune deficiencies is thymic involution. The shrinking of the thymus glands begins at birth at a rate of about 3% tissue loss per year. This shrinking continues until 35 to 45 years of age. Then the rate declines to about 1% loss per year for the rest of one's life. At that pace, the total loss of thymic epithelial tissue and thymocytes would occur at about 120 years of age. So, in theory, 120 years could be the maximum lifespan. The thymus gland produces a hormone called thymosin and is therefore also considered to be part of the endocrine system. Secondary lymphoid organs. Lymphocytes develop and mature in the primary lymphoid organs, but they mount immune responses from the secondary lymphoid organs, which include the lymph nodes, spleen, and lymphoid nodules. A naive lymphocyte is one that has left the primary organ where it learned to function immunologically and entered a secondary lymphoid organ where it waits to encounter an antigen against which it will mount a response. Lymph nodes. Lymph nodes function to remove debris and pathogens from the lymph and are thus sometimes referred to as the filters of the lymph. Any bacteria that infect the interstitial fluid are taken up by the lymphatic capillaries and transported to a regional lymph node. Dendritic cells and macrophages within this organ internalize and kill many of the pathogens that pass through, thereby removing them from the body. The lymph node is also the site of adaptive immune responses mediated by T cells, B cells, and accessory cells of the adaptive immune system. Spleen. The spleen is a vascular organ that is somewhat fragile due to the absence of a capsule. It is about 12 centimeters long and is attached to the lateral border of the stomach. The spleen is sometimes called the filter of the blood because of its extensive vascularization and the presence of macrophages and dendritic cells that remove microbes and other materials from the blood, including dying red blood cells. The spleen also functions as the location of immune responses to blood-borne pathogens. Lymphoid nodules. The other lymphoid tissues, the lymphoid nodules, consist of a dense cluster of lymphocytes without a surrounding fibrous capsule. These nodules are located in the respiratory and digestive tracts, areas routinely exposed to environmental pathogens. Tonsils are lymphoid nodules located along the inner surface of the pharynx and are important in developing immunity in oral pathogens. The tonsil located at the back of the throat, the pharyngeal tonsil, is sometimes referred to as the adenoid when swollen. Such swelling is an indication of an active immune response to infection. Tonsils have deep grooves called crypts, which accumulate all sorts of materials taken into the body through eating and breathing and actively encourage pathogens to penetrate deep into the tonsillar tissue where they are eliminated. A major function of tonsils is to help children's bodies recognize, destroy, and develop immunity to common environmental pathogens so that they may be protected in their later lives. Tonsils are often removed in children who have recurring throat infections, since swollen palatine tonsils can interfere with breathing and/or swallowing. Tonsils are named after their locations. BALT, B-A-L-T, or bronchus-associated lymphoid tissue, consists of lymphoid follicular structures with an overlying epithelial layer found along the bifurcations of the bronchi and between bronchi and arteries. These tissues, in addition to the tonsils, are effective against inhaled pathogens. MALT, M-A-L-T, is called mucosa-associated lymphoid tissue, which consists of an aggregate of lymphoid follicles directly associated with mucous membrane. MALT makes up dome-shaped structures found underlying the mucosa of the gastrointestinal tract, breast tissue, lungs, and eyes. Peyer's patches, a type of MALT in the small intestine, are especially important for immune responses against ingested substances. Peyer's patches contain specialized cells that sample material from the intestinal lumen and transport it to nearby follicles so that adaptive immune responses to potential pathogens can be mounted.